Hey everybody, this is Dr. Johnny Shen from AFC Urgent Care here in Denver, Colorado, and I wanted to do a follow-up video regarding the COVID-19 crisis that we are experiencing today. Today's topic is going to focus on when a patient should go to the emergency department or the ER in a hospital. With me today, I have Stewart Harsant, who's one of our physician assistants, and as well as Kevin Ralls, another one of our nurse practitioners. So to start off, let's say a patient comes and to our clinic or they're at home and they call us and they say, hey, I'm kind of worried, I'm not feeling the best. What kind of symptoms would you would a patient have to look out for that prompts them to want to go to the emergency department?
So if somebody called and whether they should go to the urgent care or to the emergency room, the first thing I would want to be asking about would be shortness of breath. The coronavirus infects the lungs, which can cause fibrosis in the lungs, which can even cause serious shortness of breath. So that would be the main thing that I would want to ask about if someone should come to an urgent care or to an emergency room.
Excellent. So that is definitely one thing I would totally agree with having respiratory difficulty. If you're in respiratory distress, that kind of makes you want to be in a place where they can give you the adequate sort of respiratory support. What do you think about this, Kevin?
I think, this is something that's pretty extraordinary as far as circumstances of what we have to deal with. So oftentimes we have to look at your risk as a person. And so it's really the risk. We're looking at those higher risk folks that are really standing to have complications and have some difficulties from this, similar to what you would have with the flu. So the average healthy person, as I know you've probably heard over and over again, generally should get through this as if it's a bad cold or a flu. We are really trying to kind of clear up some of those resources, and even testing, as we're getting kind of a little log jammed on some of the results here, even testing just reserved for those folks who are seeming to get sicker. Unfortunately, even going to the ER right now, if you're not presenting with any real sick symptoms, they'll likely just send you home and have you quarantined anyways, which should be kind of the safest thing to do in general. If you are exhibiting mild symptoms here, we may recommend the same thing, because there's no treatment for coronavirus, as everybody might know or not know. And we really just have your immune systems handle it. If you have mild symptoms, there's really not much to do except have you observe some of that quarantine.
Absolutely, and that's very important. And I just want to emphasize, due to limited resources, due to ERs being inundated with phone calls and patients coming in, we really need to reserve a lot of the equipment, such as ventilators and ICU beds, for people who are at very, very sick or at high risk of developing complications from COVID-19. So therefore, we want to emphasize that it's important to monitor your symptoms, but hunker down, stay at home, wash your hands, cover your mouth, do all the supportive care measures that we've already talked about in previous videos, and we're all going to get through this together. Anything else to add, guys?
Just a quick thing. I would say that hopefully these videos help. It's very common to be worried and concerned about something like this, so it's okay to be worried. Hopefully these videos can help subside some of those worries, though, and feel free to contact us as well. We can hopefully help you out with that, with general advice.
Absolutely. What about you, Stewart?
I think we covered it.
Covered it. All right. Well, stay tuned for an updated video, and just keep checking back on this website. Bye.